Happy Wednesday night. Welcome back, I Move Tele-PT community. Welcome for another edition of our Welcome to the Community. Welcome to the I Move Tele-PT Wednesday night community. We are very excited tonight. Tonight we're wrapping up our 3-part episode on chronic pain. I hope you all have gotten a lot of good information about that. And I have been looking forward to tonight for quite a while. Tonight, we're going to welcome an acupuncturist to our group. We're very excited. I'm looking forward to learning about her thoughts and treatment when it comes to chronic pain. So we're very, very excited about that. If I haven't met you before, my name is Dr. Michael Gorman. I am a physical therapist, and I am the founder of I Move Tele-PT. I Move Tele-PT is a 100% telehealth practice, and we practice in 18 states. So I'm very humble and very grateful that you have joined me on this lovely Wednesday night. And so, as always, let's make this very interactive. This is always about you all. So as there's questions that come up, please let me know. I want you to interact. If we say great things, give us the thumbs up. And by all means, if you have a question for us tonight, please let me know. And so my question for you tonight is, have you had acupuncture treatment before? That's a simple yes or no. You don't have to tell me anything more than that. You can if you want, but I just want to know, have you had acupuncture before? I personally have not. No specific reason why I haven't. And perhaps after tonight, if I start having pain, fingers crossed I won't, but if I do, I bet I will be getting some. I want to welcome Tom and I want to welcome Michael to the community tonight. Thank you guys for both taking time out of your Wednesday night to spend 30 minutes with us. All right, I want to bring into the community Afua Bromley, and that's Afua right there.
Hello everyone.
Welcome. So glad that you could join us tonight. I'm going to before we get started, first of all, give her a warm emoji clap. Ron, Maureen, Michael, Tom, Mr. Sean is on the Facebook Live. First time ever. Welcome to the community, Sean. So please give us a thumbs up and welcome her in. But I have a very, impressive bio, and because you're a very impressive person. And so I want to just read through this. So everyone give me a minute, and I may have to put my glasses on for this, but I want you to hear the things, what Afua is about. So this is great. Afua Bromley, licensed acupuncture, is the owner of Acupuncture St. Louis and Wellness Center, a holistic multi-specialty clinic in St. Louis, Missouri, actually Webster Groves, yes. Webster Groves, okay, where she practices acupuncture and East Asian medicine. In addition to her private practice, Afua worked at, do I say CHIPS?
Yes.
Which is Community Health and Partnership Services, which was a multi-specialty clinic for uninsured and underinsured individuals. That's huge, in North St. Louis from 2000 to 2012, and has previously run the acupuncture detox component of St. Louis City Drug Courts program. There's more, guys. Great stuff here. Throughout her career, she has worked to promote equal access to quality integrative medical care to those in underserved and disenfranchised communities, particularly African American and Latino communities, as well as those living with HIV/AIDS. She is founder of the Universal Holistic Healthcare Services, which is a nonprofit 501c3 dedicated to providing integrative healthcare and empowerment, life and health education through activities such as HIV Integrative Medicine Clinic, STD/HIV outreach, prevention education, nutrition workshops, and a women's support group for those living with HIV and AIDS. There's more, just wait. She is a nationally board certified acupuncturist. She's on Missouri's Acupuncture Regulatory Board, and she co-wrote the rules and regs for Missouri. former president of Acupuncture Association of Missouri, and immediate past chair of National Certification Board. You should be, I'm impressed. You should be very impressed by everything you've accomplished. I feel honored that you're here. I always try to bring guests on that not only have tremendous education, but will bring so much value to this community. And I have a feeling you are it. So welcome.
Thank you. Thank you for having me. I really appreciate the opportunity.
Absolutely. All right. Well, we're going to jump in. We have 5 questions for you.
Okay.
5
Okay.
questions for Afua. And we're going to jump right in and we're going to show everyone the first question.
Okay.
So tell us please about your educational journey and what led you to open up your own practice. And I believe you opened the practice in 2008.
2008 is when I opened up this particular center, but I've actually been in practice in St. Louis since 1999. I graduated from school in Florida in 1998, practiced in Ohio for about a year, and then moved back to St. Louis. Actually, I had intended to come back anyways, but I received a call from a practitioner who I had been in contact with while I was in school. Who knew I was planning to move back to St. Louis, at least had at the time. And they had just passed acupuncture law and were looking to try to fill the board. And he asked, because he knew I had been involved with my schools getting accredited. I was a student liaison for our school accrediting process, and had asked if I would be interested in submitting my name to the governor of Missouri to be on the regulatory board. So I submitted my name, got accepted, got appointed, and then was tasked with writing the rules and regulations. So I co-wrote the rules and regulations for Missouri.
And that was when you did that?
And so that was in 1990. We started in 99. For anybody who's ever been appointed or wants to be appointed to a regulatory board in Missouri, it is a long process. So we actually did not finish my official appointment process until I think the end of 2000. I think it took a year and a half to. So I actually started working on the rules and regs before I was formally appointed, just because we needed to hit the ground running, just from a safety concern. The state wanted to, the regulatory part of the state wanted to quickly get people under some licensing processes. Politically, a conservative legislature did not necessarily want any more regulations, but we're like, it's consumer safety. You want people to know what they're doing.
Wait. Did you say Missouri and conservative in the same sentence?
Well, I know you're surprised, but
You did. So prior to like 2000, 2001, there was no state rules and regs for acupuncturists?
No, there was only the licensing law.
Okay.
No rules and regs. So the licensing law basically set the criteria, but it doesn't actually explain about what that actually means. So until they actually write the rules and regulations, explaining the licensing law and setting more parameters, then there's not enough to go on. I mean, so, and until the rules and regs are actually finished, then you also can't issue licenses. So, so no licenses actually came out until 2002.
Interesting. Okay.
Because those rules and regulations, once they were set, and then the attorneys had to go look through them, and then there's a whole process of still, again, getting the legislature to put those into effect.
Wow.
So it was a process. It was quite the process.
Now, do all states have rules and regs for acupuncturists?
47 states have them, plus the District of Columbia. The remaining states is a little bit of a mess, but there are some states, I believe, like Wyoming, for example, has 6 acupuncturists practicing in the entire state. So convincing, again, the legislature to go ahead and pass a licensing law can be difficult, just because there's so few people that You know, they're like, you're low end of the totem pole. We really don't even want to deal with you. So, in a lot of states, it's actually the acupuncturists themselves who recognize the need to have set criteria for consumer safety. I mean, we are about making sure that our profession has a good reputation and that we regulate, appropriately and responsibly. So pretty much it's always, I think in every state, it's always been the group of professional acupuncturists who've come forward and say, hey, we need a licensing law.
Right, right. So I'm going to go off track here for just a second.
Yeah.
After the rules and regs were done in 2000 or 2001, did it help with insurance reimbursement, or did insurance companies or did they already reimburse for acupuncture prior to that?
Missouri is a conservative state, and it's conservative from an insurance standpoint too. As of now in Missouri, there are no insurances who across the board cover acupuncture. That trend is beginning to change for Missouri. It does vary state by state. For example, Washington State, California, Florida, New Mexico. Most of the insurance companies cover insurance. For those people who are veterans, the VA is in process of covering acupuncture for the veterans, and the Department of Defense is also going through that. So right now, in increasing numbers, VA centers are beginning to have an acupuncturist on staff, and they're working out the kinks. And speaking of chronic pain, actually, just effective January 1st, CMS, or Center for Medicare Services, approved acupuncture for chronic low back pain.
Nice. Good.
Which I was happy to actually work on some of the policy work with that as my role on our national board certification. But I will say that they are working out the kinks. They kind of issued that they would cover it up to 12 visits a year for chronic low back pain. But they haven't really worked out the kinks in terms of making sure that acupuncturists are going to be able to be reimbursed. So for those who are suffering with chronic low back pain, I would say coming soon, Medicare will be covering that.
Was that January 1 of 2020?
Of 2020 is when it went into effect.
Okay, got it. All right, we got a couple more people.
Yes.
Shout out. Brian's on. Welcome, Brian. Chris is on. This may be Chris's first time. Thank you. He said, good info, acupuncture, such a valuable service, and sounds like a great place to send patients. So maybe I can connect you and
absolutely.
Chris. I can't say his last name, but I'll connect you guys later.
Sounds good.
That's what the world's about, is connecting people. I'm telling you. Okay. Okay. So then you open your practice in 2008. Do acupuncturists, do most of them work in a private practice setting?
In Missouri. So I still had my own private practice when I moved back to Missouri in 99, but basically rented space from other practitioners in a variety of different settings, but then bought the building that I currently practice out of in 2008 and went under the actual name Acupuncture St. Louis and Wellness Center. The vast majority of practitioners do practice in this setting. There's not as many opportunities currently to practice in other settings, but that is growing and likely will continue. Just as one of the things that is coming out right now is insurance companies are beginning to realize that you can save money by nipping in the bud some of the root causes of people's health issues. So they're looking for efficacy, and the efficacy studies, more and more efficacy studies have been done, and now they're looking at the cost savings too with that. So we have beginning to get some real numbers to come through.
Good. Perfect. Perfect. All right.
Yeah.
Our next question, what
Yes.
are the main differences between Eastern and Western medicine? I'm curious to hear your answer on this. And
Yeah.
my good friend Sean talks about this all the time, but I'm looking forward to hear from you.
Sure. Um, I see. I was pre-med in undergrad. I went to WashU for
Okay.
undergrad.
Yeah.
And so I tell people I was very hardcore Western medicine. I was a chemistry major. I did
Okay.
research at WashU for a long time. So I was hardcore what I would consider Western medicine, which I look at as being pretty focused on often what ends up being isolated sections. So, which it is very good at doing a lot of things. Um, what I would say the difference with East Asian medicine, the type of practice that I do is traditional Chinese medicine,
Okay.
is looking at kind of everything as a whole. So, body, mind, spirit. We're also looking at the environment, um, environmental impacts, even in terms of the collective. So, like right now, we're in the midst of a pandemic. There's a level of anxiety that is just permeating everything, which is exacerbating a lot of people's not only mental health issues, their physical issues. So what I what I see and what I try to translate when I'm speaking with physicians or PTs, because I do refer to a number of PTs, and in trying to explain what is going on, I certainly use biomedical terms. Even though in Chinese medicine, I might look at it from, we say it's a bioenergetic model.
Okay.
And so we're looking at the body as if we know that everything in the universe is made of energy. We're all made of atoms.
Yep.
So if you go, that's kind of at the level that we work at.
Okay.
Um, and kind of the within that bioenergetic model, we divide up the body into a little bit different systems. There's a lot of crossover. But for example, in Chinese medicine, the liver has the functions, the biomedical functions of the liver, but it also has functions and relationship to the tendons. So if you have for example, chronic issue that might be like a tendonitis and you have this recurring tendonitis, I'm going to look at what you're physically doing. Like if you're playing tennis, yeah, but I'm also going to ask you questions like what's your stress level? Look at lots of these other components that may actually be making your predisposition to having tendonitis be much worse. So I've got in Chinese medicine got to deal with your underlying root in addition to the physical activity.
And how does blood work into that? Like, can you order blood work? Do you look at the blood work?
I do look at people's blood work. The school that I went to in Orlando included pharmacology. I mean, we got the whole gamut of kind of Western medicine classes. Also, and in Florida, I could order people's blood work. When I worked at a hospital in China for a summer, and that was actually great. I worked in the East West, kind of the integrative medicine unit. So if
Yeah.
somebody needed an X-ray, they needed blood work, I could order that without a problem. Um, so, I mean, that for me is ideal, is being able to use these different tools in these different sections. I tell people, I practice Chinese medicine, but I'm not going to tell you that it is the only thing that's out there, because different people's bodies may respond to different things well, and it may need multiple areas and strategies in order to actually correct your whatever your issue is.
Right.
Um, I would say the one other big difference that I see is really an emphasis on prevention. And we traditionally, we would actually be seeing people while they were healthy to prevent them from getting ill. That's not the model that we work with in the US, but
Right.
it is what it is. We're working on it.
Perfect. Well, that's going to kind of lead me into my next question for
Yes.
you. What types of patients respond best to acupuncture? And I
Mhm.
want to know, like, what do you typically see when a patient comes in your office? Are you seeing a lot of back pain, or is it really the whole gamut of everything?
I see the whole gamut of everything. I would say some people's practices have a much heavier emphasis on acute and chronic pain. My practice, I'm kind of known for being kind of the last resort. So I tend to see people with a lot of chronic diseases or things that nobody can figure out. I have a couple physicians who refer me patients who are like, if I don't know what's going on with them, I just send them to you. and fortunately, I usually can figure it out because from a Chinese medicine perspective, all the patterns make sense. And so it's like, oh, this is what's wrong and this is how we deal with it. And, a lot of times, fortunately, their bodies respond. But I really do see the gamut. I definitely see a lot of pain. And right now, as I'm just opening, a lot of my people, it's pain, and then it's my people who with pretty severe chronic disease. But I do see everything from upper respiratory infections to fertility to autoimmune issues, oncology, for migraines, gastrointestinal issues. Um, it's I see it. Pediatrics. I'm one of a few people who see small children. The clinic that I worked at the hospital in China actually was known for its pediatric clinic, and I spent most of my time um, working in the Tweenaw department, which is kind of sort of like a cross between massage and PT, but I would say heavier on the acupressure massage portion of it, and we saw a lot of pediatrics in that department specifically. So yeah, and then acupuncture, herbs, nutrition, lifestyle changes, kind of the whole thing.
So I feel kind of bad because I haven't asked you an important question. And I feel bad because I haven't had you educate our community about this. But so can you briefly tell us, how does acupuncture work?
Sure. So we look at the body again from that bioenergetic model, and we divide up the body into 12 what we call meridians or channels. So think highways of systems.
Huh?
There's some correlation with nerves, but not totally. So I don't often use that nerve correlation, though there's
Do
some
they run up and down?
overlap.
These channels run up and down?
They do run up and down, but sometimes the direction is down and sometimes the direction is up, and then there's zigzags. So you can have, for example, um, let's see, you can have the liver channel, which we say actually starts on the big toe. And then when it goes up, where it goes up actually goes up through the body and then exits the head.
Okay.
So I can do a liver point, though, which is on the foot, to treat headaches that we say are caused by disruptions above on the liver channel. So when we're diagnosing, we're looking at either too much, too little, or a block in energy. And that one of those three things is going to cause a problem in the body. So whether you have pain, disease, whatever the case is, it's going to cause a disruption. There's really over 400 fixed points on the body, including points on those 12 major channels. We call 8 extraordinary channels, plus a whole bunch of other systems. And in East Asian medicine isn't one thing. So there are all these microsystems within that. There are all these, because this is a system over 5,000 years old. So are all these, lineages and different geographic sections where you might see different patterns of disease. And so you'll see an evolution of a particular kind of theory within that still is basically the same, but a little different.
Right.
But it's why I can do a point on the hand that treats headaches, but also induces labor and works on back pain.
Does the energy block that you were talking about earlier, so you said there's either too much energy, not enough, or there's an energy block.
Right.
Does that energy block correlate to like an area of inflammation or swelling kind of block?
Often.
Okay.
Often.
Okay. So I get it.
Yeah.
Because I can't tell you how many times Afua that a patient would say, "Hey, Mike, do you think that acupuncture works?"
Yeah.
I'm like, look, I said, I really don't understand it, or I've never really studied it. I said, but anything that's been around as long as acupuncture does, it must help a lot of people.
Yeah, it does. And I'll be the first person to say there are people certainly that they don't necessarily respond to acupuncture, but that's kind of anything. Nothing
Sure,
works 100% of the time for everybody.
absolutely.
I generally tell people, if you come in, I'm going to tell you, yeah, for most people, this syndrome usually resolves. But there's some things like, I'll give the example of tinnitus. Tinnitus is about 50-50 on whether it's going to work. We'll know within the first probably 3 treatments if you're going to have any effect or if it's going to be something, you could be coming to me for years and, barely make a dent. And other times it's one treatment and it's gone. So,
Got it.
some things have a more of a pattern. Things like back pain, as you know, as a PT, some people's issues resolve really quickly and other people it takes a little bit longer.
Are there things that you have people like, for example, from a physical therapy standpoint,
Yeah.
we give people home exercises to work
Yeah.
on healing at home.
Yeah.
What does an acupuncturist do as far as home treatment for your patients?
For home treatment, I am one who pushes nutrition. And so I give almost everybody dietary recommendations that fit their body, their
Right.
particular constitution. I do teach people acupressure points to use at home.
Okay.
That is extremely helpful. And teaching somebody 2 to 3 points that they can manage is great. Um, I do refer a lot to people, other practitioners. So if you're coming to me often for something physical that is resulting in less function, then I may need to direct you to other practitioners to kind of complement that. And one of the things that I actually often do for people with back pain or knee pain is I do refer them to PTs because I always say they're very good about gait and often how people walk, how people carry themselves tends to perpetuate their physical issue. And so it's like, okay, if you can analyze that, that's not my area of
Absolutely.
expertise. So
What's a normal, and again, I'm just curious because I've
yeah.
never experienced it, but a normal patient visit, is it
Mhm.
30 minutes? Is it 10 minutes? What's normal?
Normal is about an hour.
Oh, an hour. Oh, okay. Wow.
So,
An hour. Okay.
so you're
Are you working
usually
like one-on-one with them for an hour or?
not typically. I would say your first session is going to be an hour with the bulk of that, a fairly lengthy intake. The needles will probably be in for about 20 minutes, 20 to 30 minutes, in which usually the practitioner has left the room for that so that you can kind of zone out. Sometimes you do both sides, both front and back. So that varies, and I may do manual therapy to cupping or
Yeah.
some what we call tweenah. So that part varies.
And when you do the acupuncture, do you ever do electrical stimulation with it, or is that
On occasion, I do. We have a number of electro stimulation units. My population of patients has a tendency to be very sensitive, and often that is overstimulating for them. But I do have it in case they need it. There are some practitioners who use electric stimulation all the time. Just the people who come to me tend to be those people who are extremely sensitive.
right? For sure. Okay, cool.
Yeah.
Well, that's awesome. See, I'm learning. I love it. All my question is for free. All right. My next question is a little bit involved. So let's see. You can take this
Yeah.
however you want.
Okay.
Future of healthcare. What do you see specifically types of healthcare that people seek for reduction of pain? How
Yeah.
do you think it's going to evolve?
For me, what I'm seeing the national trends is insurance companies and large healthcare systems are starting to really see that these isolated individual methods that they've been using are not very effective. The opioid crisis has definitely shown that people need to take more than just a pill. So there's definitely a push into looking at, I would say, integrative medicine. So patient-centered medicine, that is what is most appropriate for this patient. What therapy or therapies does a patient feel is best for them? What do they respond best to? And I do think that over time there is going to be more and more of a trend towards that. I think a lot of patients are taking it upon themselves to do that, and now insurance companies and healthcare systems are starting to finally get the picture that people want what's effective. I have a completely cash-based practice and I'm full, because people are into, I need what works so I can get better. Or if I can't be completely out of chronic pain, how can I make my pain be manageable
Right.
so that I don't need to take opioids, so that I can, I can go for a walk, I can play catch with my grandkids, I can, function better, live better, looking at the quality of life. So for pain reduction, I've really see people not wanting to take meds for sure, or minimizing it. And then, people really want to be better. They want better function.
I'm gonna throw a question at you to see if you get it right, because
Yeah.
on our Facebook Live on Monday, we talked about how much chronic pain out there is.
Yeah.
What percentage of Americans do you think have and live with chronic pain?
I have seen numbers as high as 80%.
Wow.
But I
So
think the official number is something like 60%.
60%?
I
Okay, so
think it's 60%.
that's much higher than we had. So we had 1 in 5. So we had 20.
Okay.
When I say
Okay.
chronic pain, I say more than like 6 months.
Okay.
But
So
okay,
more than 6 months, and the 20% is probably about right.
yeah.
Honestly, I think that's low.
Do you?
I do think that's low. I would say probably, and I read her World Health Organization reports and all these reports, and so, um, their numbers are really high. Like for chronic back pain,
Mhm.
they tend to say that at any given time, there's about 60% of people who are living, adults like over 25, I think, have experienced chronic back pain longer than 6 months
Yeah.
at some point in their lives.
Yeah. That's exactly.
So the numbers are high, and I think sometimes it's underreported because people have a tendency to, if they've learned to manage, they don't consider themselves to be a chronic pain sufferer. Like, I'm a former athlete, and if you ask me if I had chronic pain,
Wait, your former athlete, that didn't get on here.
that didn't get on there.
What the heck?
So I played, yeah, chronic pain, like dislocated my shoulder 3 times swimming. Then I found out that, that's a common injury for Olympic swimmers, but, I didn't make it to the Olympics, but I would never describe myself as a chronic pain sufferer. But do I have pain a lot? Yeah,
Yeah.
a
Yeah.
lot. But, most athletes you kind of suck it up and you keep moving. And it's not until you can't move anymore that you're like, oh, okay, now this is a problem.
Right.
Um,
Absolutely. Absolutely.
but yeah,
All right. Before I ask your last question,
yes.
I want to acknowledge a couple people that are on here. Andy is on here. Sean, welcome. This might be the first time for Sean. Christopher, welcome, welcome. Look forward to talking to you on Friday. We have a really good group tonight. All right, so you've taught us a lot so far, and thank you so much. What I like about this is it's so important. If you are having pain, or if you want to keep good health, it's important to have a team of people around
Yes,
you. Not just
absolutely.
one person is
Yes.
going to do everything. You probably will need to have a physical therapist, acupuncturist, a very good physician that looks at the body holistically. I think
Right.
is so important. I mean, there's so
Yes.
many factors,
Yes,
and so I'm
absolutely.
glad. I do think that is starting to evolve. It probably has evolved much more on the West Coast than here.
Yes, it has.
But so yeah, and can you tell everyone the type of providers that you have in your office?
So we have 4 of us acupuncturists. We have a PT. We have a naturopath. We also have 2 massage therapists who do very different types. We have one person who does Japanese shiatsu and what
Okay.
they call eclectic, and then one person who does deep neuromuscular massage as well as um, foot reflexology. I'm making sure I don't forget anybody. I was like, I'm sure I'm forgetting somebody. We have another former nurse who does Reiki or energetic
Yeah.
treatments, Touch for Health, and we have somebody who teaches meditation. So that's
Wow.
we have a big office. We're not here all the time.
Sure.
Different people have different hours. So,
Okay.
but yeah, we're really fortunate that we have a really good group of people.
Is the whole practice cash based?
The whole practice is cash based. Insurances in Missouri, everybody push your insurances to start
Mhm.
covering more
Absolutely.
things. Yeah.
I always say lobby down in Jeff City as well.
Yes.
Know
Yes.
who your state senator and state
Yes.
representative are. Know those people because you got to start talking to them. But I love the fact that you have a cash-based practice because so many people are afraid. Well, so many people that get reimbursed by insurance
Yeah.
are afraid to do it. And I've always said if you are good and you put out a good
Yeah.
product and you care,
Yeah.
you can make it. And the fact that your whole
Yeah.
office is cash-based says a lot because people do have a lot of options out there as far
Yeah.
as treatment of pain. So that's big kudos to you. All right, my final question for you. What is your mantra? So I love to know what people live by. Do you have
Yeah.
one saying or one mantra that you can share with the community?
Um, so I always say it's all good all the time. Like it gets on my kids' nerves, but it really is. It's kind of one of those things where bad stuff happens, but
Yeah,
it's all good. Often, challenges that we have are opportunities to either learn a lesson that may improve our lives later. Um, so I tend to be a very optimistic person. And so, yeah, it gets on my kids' nerves. And they're like, Mom, I just lost my job. It's not all good. I'm like, it is, because what opportunity can you have now? What are you going to do now?
that's right.
Like,
That's right. That's
um, so that is my mantra, and I'll just share my other favorite saying that one of my elderly patients used to tell me, and they lived to be 102. So they knew something. When I would say, how's your day? And they're like, it's a great day. I woke up on the right side of the grass. I'm like, it's all good, you know, it's all good.
that's right. Yeah. I always say too, when one door closes, one door is going to open.
Absolutely.
So
Absolutely.
I think that yes, how many of our millions of Americans have lost their jobs, but I think you're going to see a lot of innovation
Yeah.
come out of this new way of doing things that will take time to get there, but
Yes.
it will. It will.
Yeah.
So before I let you go, first of all, thank you. You're awesome.
Oh, thank you for having me. This has been a lot of fun.
Absolutely. It's my pleasure. This is how you can contact Afua. I want you all to reach out to her, communicate with her, learn more about acupuncture. And look, if you've had chronic pain and if you are still dealing with it, and if you've done a lot of other things and you haven't tried acupuncture, I would absolutely try it. So I think
Thank
it's
you.
a great thing. Real quickly, let me see if there's anyone that's said anything. Tom, thanks you for giving us great information.
Oh,
FY,
sure.
thank you.
And if I can share something really
I
quick,
do.
I always try to share our national boards registry, because no matter where you are in the country, my board that I'm on, our national certification board, is nccaom.org. There is a find a practitioner registry, so you can find a national board certified acupuncturist throughout the country. So and actually some who are international. I use that. And helping people, some of my patients who move overseas, and I use that same registry to help people find somebody who's taken the boards. And so there are 3 to 4 boards that you have to take in order to be a licensed acupuncturist. So
That's great.
get somebody who's got good training.
Are there in Missouri?
In Missouri, I think we are at 135.
Oh, wow.
Pretty
Okay.
close to that, which is great considering when I wrote the rules and regs, they told us we had to come up with 20, and we were like, "Oh, I hope we can come up with 20." So it's been really fun to see the numbers grow, and
Yeah.
we do recruitment, like, please come to Missouri. We need more of us. We need
Yeah.
more of us.
But
So
if there's only 135 of you and you're good, that's called job security right there.
it is, but you know what? All boats, rising tide lifts all boats.
That's right.
That's really our
I say
motto.
it's all good.
Yeah,
It's
it's
all
all
good.
good.
I have a couple of questions for you. One is,
Sure.
what is the cost of an hour of acupuncture?
Sure. Um, our cost, it's 110 for an initial visit.
Yeah.
And that initial visit usually lasts anywhere from an hour to an hour and a half. And that includes the intake as well as treatment. And then follow-ups are 75.
Okay, perfect, perfect. Brian would love to see you do a demo on me. So who knows? Maybe we can do that on a follow-up.
Maybe we can do that someday.
Yes, and okay. So I think that's probably, well, hey, thank you so much
Thank you.
for being here. You've shared your knowledge tremendously well. You're a great speaker, and thank you for sharing. Now we're all a little bit more educated on acupuncture.
Thank you so much for having me. Keep doing good work. I love connecting with other practitioners, so
All
I
right.
appreciate you.
Have a great night, okay?
Thank you. Thank
All
you.
right.
Bye-bye.
Bye. All right, everybody. That was fantastic. I hope that you really enjoyed having Afua on. I mean, it was, again, I'm always humbled because the people that I'm bringing on here are so darn intelligent. Incredible, incredible, incredible. So please reach out to her if you have any questions about acupuncture, if you're having pain and want to give that a try. I think it's absolutely a great idea. All right. So a little bit of change. I know change. I say the word change and people get a little bit scared, but don't worry. So starting tomorrow, I'm going to drop my Thursday Facebook Live. I've got so many things going on, and there's so much content I want to write and so many things that I'm just going to drop down. I'm going to continue to do Monday and Wednesday Facebook Live. Same bat time, same bat channel. For those of you that are older, you know what that means. Same bat time, same bat channel. So we're going to continue on Monday and Wednesdays at 7 p.m. Central Time. This upcoming Monday, it's a holiday, but hey, you need to take a break from family on a holiday, and who knows what this holiday is going to be like. But 7 p.m., I'm going to talk about golf. I love, love, love golf, and I'll give you 5 tips for having better physical function, better physical performance on the golf course. So if anyone in the community has family or friends that are golfers, please share that with them and tell them to join us Monday night at 7 p.m. I hope everyone has a wonderful extended holiday weekend. It's kind of weird. I don't really even think about it as a holiday weekend, but I guess it is. So have a great holiday weekend. I'll catch back up with you Monday night. And as always, stay home and stay strong. Have a great night, great weekend. Bye-bye.